I'm Dr. Sheryl Clark. I want to speak to you today about a revolutionary new procedure for fat reduction called CoolSculpting by Zeltiq. In September of 2010, the FDA approved a new technique for fat reduction called CoolSculpting. I was one of the first of just a few doctors asked to begin to perform this treatment on my patients. I have a large number of patients that we have treated, and we have a great deal of experience with this, and I've become very excited about it, and I'm very impressed with the results. So I want to tell you a little bit about how this came about. For the last 10 years, the scientific community has been very interested in developing techniques that will reduce fat painlessly, safely, permanently. And until just recently, there was no technique that met all of those criteria. I believe that Zeltiq is the only one that meets all of these criteria. There were treatments that were invasive, such as liposuction, where side effects could be seen, including infection, bleeding, and very serious reactions to anesthesia, as well as rippling and incomplete removal of fat. So then heat-involved treatments were developed, such as the diode laser and the ultrasound. These techniques do result in some reduction in waist size or reduction of fat in the treated areas immediately after the treatments, actually one more than the other. But in the case of diode laser, for example, little holes are made in the fat cells, and then the fat cells actually don't die, so the fat reaccumulates with time. With the CoolSculpting procedure by Zeltiq, however, the fat cells die and do not return. And this is accomplished by a very brilliant and simple physical fact, which is that fat freezes at a higher temperature than water. Since there is very little water in fat and a lot of water in skin, cold is applied to the skin on the overlying surface and slowly allowed to become colder and colder. The cold temperature of these plates allows for very controlled, very carefully controlled chilling of the fat to the point that the cells will be injured enough that they will die. So the way that this occurs is via a process that we call apoptosis, otherwise known as programmed cell death. But this is a very natural procedure. It's actually the way all of the cells of your body go away naturally when they're being eliminated as you grow and as you have turnover of cells. And the really wonderful thing about this method is that the cells are injured, but they don't release their fat contents immediately during or immediately after the procedure. They get resorbed slowly by a natural elimination process via macrophages. In other words, these macrophages, which you might think of as little Pac-Men in the skin, come into the fat tissues, they ingest the dying cells, they carry them away to the lymphatics and dump them into the lymphatics, and then the lymphatics go to the gut and they're naturally eliminated through your body. There's no spike in serum lipids during or after the procedure. Unlike liposuction and some other forms of treatment, there's no elevation in your serum lipids, your triglycerides, or your cholesterol at any point in time during or after the procedure, which makes it completely safe in that regard and completely unique. So, I investigated a lot of different techniques. I'm very conservative. I'm scientifically based. I did years of research in the lab before I went into the practice of dermatology, and so it's very important to me that any procedure be completely vetted and proven and reproducible and reliable. And what I really like about this procedure is that it meets all of those criteria. We see the same results from patient to patient. There aren't patients who are resistant to therapy or to the treatment who won't respond. We know that as long as we can identify an area of fat that can be drawn up into this device, the 20 to 25% of the cells within that area are going to die and not come back. Now, the patients for whom this is most appropriate are patients who have localized areas of fat deposition. For example, a common story that I hear is that, oh, I've dieted, I've tried every diet, I've been really good, I've restricted my calories, I've actually lost weight, but I just can't lose the weight, I can't lose the fat in this particular area. For example, the lower abdomen, the upper abdomen, the flanks, what we might call the muffin top on the sides of the abdomen, the back, the lower back, for example, the part of the back that is under or above the bra, the part of the front of the chest that is above or below the bra, the inner arms, the inner thighs. And also, by the way, areas where a patient has had liposuction, where they've been left with some localized area of fat that wasn't treated completely, or where there was some rippling or irregularity. Also, this treatment can be used in areas where liposuction can be complicated or difficult or risky. For example, the upper abdomen, the inner thighs, the upper chest. So my patients' experience has been that they've been very surprised, and I've been very pleased that during the treatment they might say, oh, it felt a little tight from the suction for a few minutes, but then that went away. Or they might say, I felt a little numb afterwards for a few weeks. Or they might say, it felt a little sensitive when I pushed on it for a few weeks. But nobody has told me this is a painful procedure. Nobody has said I would never do this again. And every patient has said, this was really worth it, and I'm thinking about getting another area treated that I haven't had treated yet. So for me, I think this is a win-win. Everybody's happy, they're excited. Just imagine being able to get rid of fat painlessly, non-invasively, with no needles, no anesthesia, in an hour of your day, and being able to go about your business afterwards, and then afterwards watching that area reduce slowly over time. I think it's great.